Hi, I'm Kathy Taranto with AesthetiCare, and today I have Dana Wright with me. She's very shy. She's probably not going to have a lot to say.
Whatever you want me to do, I will do.
And nobody really knows your voice.
No, not at all.
Yeah.
It's always my voice that gives me away.
Oh, we're so happy to have you here. Thank you for coming and being willing to share your experience.
One of my favorite places. I love being here. In fact, I tried to slip in for a little touch-up right before we did this, and they were like, we'll have to take your makeup off, so we're doing that after.
We'll do it after.
Yeah, that's good.
Yeah, start over. Because you look beautiful.
Oh, you're very sweet.
Yeah, you look beautiful.
Very sweet.
So, what was your first experience like with AesthetiCare? How did you find us? What was your first treatment?
So I found you guys through Matt Taranto, of course.
I know him.
Who you know very, very well. And our daughters go to school together and have gone to school together for years. And it was right as the Botox thing was starting to be more mainstream. I had 4 children. I looked like you could swipe a credit card across my face. And I remember coming in and thinking, God, do I really want to do this? Is it going to hurt? No, it does not. And it became very quickly, like many women, my favorite treatment because it's quick, it's easy, you can go right to work, it does not hurt. And I mean, I'm every 3 months, 4 months I'm in here to do it.
You nailed it. Thank you very much.
Yeah, you're so welcome. I love the Botox.
So do I, but I think so many women are scared.
Yeah.
They're nervous about, and men are nervous about it. And I think you hit it right on where it's not painful.
No.
It doesn't hurt, it doesn't hurt.
No.
It's very fast is what I was going with. And it looks great. Like it looks natural. You don't look weird.
Yeah, you don't have to have and I've not branched out and done all over any of that stuff, but I do want to ask you a question because I clinch really bad.
You should do it.
In the middle of the night, and I have heard.
Dana.
Have you done it?
Yes.
Okay.
Because I get headaches, and so.
Tell me about the jaw
do
Botox.
super easy.
Now I'm interviewing you. This is what I do.
Yeah, so Botox can be used for a number of different conditions. And in fact, it's used in the medical world far more than it is in the aesthetic world,
right.
For a lot for migraine headaches. And so if you do have a lot, like the clenching in the night, if you're sore in the morning, if you get headaches from that, it's very simple injections right down here. I do it on a regular basis.
Talk like this on the radio?
You know the other, no, you don't. I don't know, am I talking like that?
Are you sure you want to do that? And I'm like, I don't think it makes you not talk.
So one thing I would suggest is that I actually do it here and I also do it down here because I make this weird face as I get older that's like pulling my face down and I'm getting these weird little jowls, which I really don't like. Yeah. And so recently I've started to do Botox closer down to my chin. Sure. And so I feel like that takes some getting used to, but for the clenching,
nothing. I'm doing it today.
Yeah.
Today. Because I can feel it now. My teeth are like ground down.
Yeah.
So, but I love that you mentioned Botox is not just, I have a friend who has migraines and through their physician has Botox treatments for that. And so, and it's natural and you don't have to look like one of those Hollywood overdone. We all see actresses where you're like, oh, honey, stop doing that to your face. Yeah, you do not have to look like that, and Botox is the perfect thing for that.
No, and we will not do that, even if we have people that want it.
Yeah.
Because we just, we want you to feel refreshed. We don't, we don't want someone walking around with the wrong look.
Yeah.
So we try our best to really make sure it's just the refreshed
I love
look.
it.
Yeah.
So I started with Botox, and then we just went right on down the road and kept going.
I mean, that is our hope and dream. I mean,
it really is.
But because you're happy.
I am so happy.
Yeah,
I am the only person on our show, and we have a 27-year-old, and then we have Scott, and then we have all of the music people down the hall. I am the only person on our show who has a tattoo. And we joke about that because when I came in and told Scott, I've got a tattoo, you want to see my tattoo? He was like, oh my God, midlife crisis, you did not get a tattoo. I did not get a traditional tattoo. You guys did my eyebrows.
Oh, yeah.
And it is my most favorite
I didn't even realize that's where you're going with that.
I have ever done. Oh, yeah. Just go around telling people, I've got a tattoo. And you ain't ever going to guess where it is. I was a child of the 80s. And I was in high school when our hair was like up to here. And we slaughtered our eyebrows.
Pluck.
I mean, I'm using the word slaughtered. And if you're around my age, you know what I'm talking about. I mean, it was very in to have very thin, awful brows. And so I guess over time, you tell me, your body just goes, okay, we're not going to give you brows anymore.
I think it's women that we've overplucked or, there are just certain hair conditions that women have. And thinning hair is very, very common in women in mid-40s and mid-50s and up. So whether it's on our head or our eyebrows, wherever it is, like that's just a common thing that starts to happen. You know, women will come in and be like, I don't grow hair on my legs anymore. I'm growing it on my face.
Yeah.
Like hormonal fluctuations of the body just change hair growth patterns. Yeah. So it's common. Eyebrow thinning is very common.
Cool. Well, if you slaughtered your brows, you can get them tattooed, and it's not like a tattoo. That's, first of all, you are numbed. And I want to point that out because I had a friend who did this about a month ago, and we were talking about it. And she did not come here, and she's going to next time. She said to me, it was the most pain I've ever been in. And I go, what are you talking about? And she said, they use these blades. And I go, did they not numb you? She's like, no. And I'm like, oh my God, go to AesthetiCare. What are you doing? Yeah. You are numbed. I felt no pain. I want to describe the next day as like a mild sunburn on my eyebrows, but not painful, just mild. I could tell, kind of like when you've got a mild sunburn. And then my eyebrows are now back where they belong on my face. And we all have friends that you don't want to say, honey, it's time to put your eyebrows back where they belong. I mean, it's hard to look at someone without eyebrows. I'm like, oh my God, put them back on. We all did it. It's okay. We all got rid of them. They need to go back on your face.
Well, and they're, you know, for women that have the hair, but it's now gray, you can tint that hair.
Correct.
So we offer that service as well. If you're not quite ready for the microblading or the tattooing, you can start with a tinting. And that's really common.
Yeah.
But if they're gray and they're also thin, the microblading is such a nice option. Yeah. Because you go to the pool and it's not like your eye pencil comes off. Yeah. Like it's just nice. You'll be at the lake and you look like it just doesn't come off, which is great.
It takes about 10 minutes to get used to it. Like right after they do it, it's a little bit darker and then it fades over the next couple of days.
Right.
And so the first day you do it, I mean, I remember like, I look like Frida. Oh my,
don't
it's
panic.
Dark, don't panic.
Yeah.
And then within a day or two, it settles, and these are now the brows that you guys did for me.
And you have to tell your partner, your spouse, like, don't panic.
No.
They're dark, I know.
And it will
They
open
told me
up
this
your
is normal.
face. I mean, I have friends that I so badly want to do it, but it's hard. You can't really say, I need you to go to AesthetiCare and put your eyebrows back on your face where they belong. So if you're listening and that's you, you know it's you. Do not make me tell you that. Put them back where they go.
Well, talking about hair growth, have you ever done Latisse?
I have not. I've heard about it. I've not done it.
Oh, you got to try that.
That's the
yes.
Okay.
Because you have beautiful lashes, but you're out and about in the community a lot. Probably have to put some makeup on.
I want the big lashes.
But you know, because I see the. You know, I don't want the massive ones. Yeah. I want mine to look natural, but long and luxurious.
Do you have them on because they look amazing?
No, but thank you.
Okay, you are born with great lashes.
Hey, Latisse works.
Yeah.
At first you're going to think it doesn't work because you're applying this solution along your lash line. You're like, it looks like I'm putting water on.
Right.
And then just slowly, because again, you've got to wait for the hair to grow.
Sure.
So you need to stick to it, commit to the process, and Latisse works.
Do you guys also do the lashy lashes? What do you call them?
We don't do the extensions.
You do the Latisse?
We do Latisse.
Okay. Because there are a lot of people I know, and I'm one of them, that with the lashes that they put on, I'm allergic to the glue.
Oh, yeah.
So I couldn't do that anyway, and I don't think Latisse has that issue. For me, it doesn't.
No, and the thing is with the lash extensions, I've seen a lot of women who do that, and then they lose their lashes, like it pulls some of them out. And so once you start, most of the time you really have to commit to it, which is fine if that's what you want to do.
Sure.
But Latisse is an option that you apply, you grow them out. When you feel like, okay, they're at the length that I want, you just start to back off of it. So instead of using it every day, it's every 3 days, and you get to like once a week.
They come out to here.
Yeah. You're like trimming your lashes.
With the magnetic ones,
that'd be a great problem.
No, I was emceeing an event once with the magnetic lashes, and if one of those little magnets like comes outline, it like dangles, and it looks like you have a dead caterpillar hanging from your face.
I could never get the magnetic ones right.
No, you've got to get it exactly lined up. I'm not coordinated, and now my eyesight's going because I'm 47. I can never get it on. So Latisse is probably what I need to do.
It's a great option, and especially because you've got these beautiful brows and you have gorgeous lashes. But you know, if it is like the day at the pool and you don't want to wear a whole bunch of mascara. Your lashes are naturally longer, they're thicker, and so it just opens up your eyes.
I love it.
Yeah, it's another option. All right, so what else? What were you the most nervous to try at AesthetiCare?
I was the most nervous, I think, about the Diva procedure, and it's been a couple of years since I've done it, because it's like a gynecological procedure, sort of.
It is.
I mean, I remember going in there and I saw this machine and I'm like, where is that going? But I ended up loving it because I have had 4 children, and this is the procedure that helps you stop when you're giggling or jumping or laughing if you have incontinence as you get older. This stopped it. It stopped it.
Yeah. And no, I mean, like, how long did it take?
I'm trying to remember how long I was back there. Okay. All I remember was that machine, and I'm like, where is that going?
Well, because we do use a numbing cream inside the vagina first, so it's a very simple application by one of the healthcare professionals.
I just remember thinking, like, okay, what are we doing? But within, I mean, minutes, we were good, and I have not had that problem since.
Amazing.
And I infamously peed my pants on The Price is Right when I won The Price is Right, jumping up and down. I was laughing.
The fact you won The Price is Right is pretty amazing.
Like, it's one thing to win it. It's another thing. You're like urinating on the man model because I'm jumping and I'm like, ah! And then I'm like, here it comes. Yep, that is me. And that was before the procedure. And we made huge jokes about that at the time because every woman listening, especially if you've had 4 kids like I have, natural births, as you get older, that is something that happens to you. It just is.
It is, and it's something that women refuse to talk about, and it's something that is one of the reasons why I love to talk about with you, because you'll always share your story, and it's so impactful. We could help so many women.
Do you know how many women have this happen? Coughing, laughing, jumping. I mean, get on a trampoline, it's over for a lot of women.
A baby or multiple babies in your 40s and up. Women that have, I mean, there's just so many reasons and things that cause it, but those things, which is a large majority of the population, is experiencing either a mild or moderate experience with whether it's incontinence when you're jumping up and down, or even just urgency, having to get up in the middle of the night to go to the bathroom. And so,
do you have to repeat it? Because I still don't have a problem, and I think we would have to look. I think it's been 1.5 years or 2 years since I've done it.
So I always, everyone's different.
Yeah.
So, if you look at the skin on my face, the skin on someone else's face, so, all of us in the room, we're all going to need a different package based on our age, our skin age, and what results we want.
Sure.
And so with Diva, it's very similar. So generally, it's 2 to 3 visits. The treatment's done in 2 to 3 visits or 2 to 3 treatments, depending on if it's mild incontinence, if it's just from jumping up and down, or if it's just, it's not
because there are women that have
related.
the full-on, like, it keeps happening. Right. And that was not me, but that is some women.
Right, yeah, or people that play tennis, and so they're wearing a pad or a tampon or both while they play tennis. Those are women that are also candidates, but once it gets to, it's one of the reasons why we do a consultation, that we can put together a package specific to the needs of the client.
Perfect.
And so with that, though, I would suggest that you revisit it now or within the next 3 to 6 months, you do another treatment, because just like the skin on our face and our muscles and our tissue, like inside the vagina, we can't see what's happening. So it makes it a little bit more difficult to know, like, okay, now's the time. And I would rather you manage it versus start having the incontinence again and then try to fix it. Because the Diva treatment creates a thermal injury type response in the tissue, brings in blood flow, creates healthier tissue, and gives support to the bladder. And so if you do 1 a year, which would be a great protocol for you, would be 1 a year. And you could spread that out between 12 to 16 months. But just to keep that tissue healthy, you'll maintain those results and prevent having issues.
It's one of those things that you don't realize how good it is until you've done it, and you're like, oh, that's not happening anymore. That's really nice.
I know, but it's like you go to the dentist, and if you forget to book your next dental appointment, then all of a sudden you've got a cavity. So, you've got to keep up on it. Yeah.
Do you find that it's easier for women to talk about vaginal health now than before, or are women still like I can talk with you about it, but I don't know, and I'm pretty open about everything, shocker. I still think even with physicians, it's hard for women to be like, this is what's going on.
Yeah, I think it's getting better, and probably because I've been talking about it more and more, and my friends are they're used to me now.
Talking about it?
Yeah.
And talk to your daughters about it,
and just
so that
say
it's
the
not
word
weird
vagina.
for them.
We all have one.
Yes.
It's
okay, say it.
Yeah, so I think you look at Botox back when you started getting Botox, and a lot of women weren't ready to tell their friends about Botox, and now they're all posting the experience on Instagram. So I think we're moving in that direction, and this is one of my hopes and dreams, is to continue to talk about it, because it's not just about, which I love, softening wrinkles and treating acne scars and pigment and those types of things, because those are life-changing too, but this is functional health. This is changing a lifestyle. It's just such an important treatment. And, women that have gone through cancer and chemotherapy, many times the health of the vagina is is horrible. It's dried. They can't have sex anymore.
Yeah.
And we've had clients that come in and they do diva procedures and they can have sex again.
Okay, that is important because how many women watching this or listening, we're going to talk about, well, you
I
do
mean,
my
it makes me
podcast.
almost
You
want
have
to
to do my
cry.
podcast.
I'm serious.
Because that is a huge part of life.
Yeah.
And then you think of all the women like 30 years ago or 40 years ago. What did they do? Oh my gosh.
My mom went through that.
Oh my gosh.
And they stopped having sex.
Yeah.
And there was like no solution. And she passed shortly after.
Oh,
but,
honey.
you know, it's just
Yeah.
like, I mean, has made such an impact on my life. And I feel like, you know, we've got this procedure. It's not surgical. The laser time itself is like 3 minutes. You're completely comfortable during it.
Good.
There's no pain after, right?
Right
I mean,
now,
I mean,
no.
I didn't feel like I had
No.
a lot of pain. It's like such a great solution. And yet very few people know about it.
Okay, we're going to shout that from the rooftops, especially for the cancer patients. That is,
Yeah.
that's the last thing they need on top of everything else.
Yes,
you know?
and it's just damage. It's hard on a relationship.
Yeah.
You know, you go through fighting cancer, and then the connection
Right.
is limited too, and it's just helping them reconnect. I think that's so powerful.
It's important. I love it.
yeah,
Will you do
so-
my podcast?
I would love to.
I want you to
would
do my
love
podcast.
I would love to.
We're going to do an entire podcast about that. Yeah, we
yeah,
are.
we are. A series.
I know.
So, what about Emsella, the chair?
I have not done Emsella.
Okay, we're going to get you on the Emsella chair because, you know, especially if we're going to be doing a podcast, you know,
Do you
talk
call
about
it the chair?
I mean, is there any other chair? It's the throne, the chair?
What is this? I love it.
Okay, so Emsella is a device that is based off of MRI technology. It's actually, we bought a sister device to it to build muscle in the abs and build muscle in the bum. It's called Emsculpt, and that company is a physical therapy company to start out. Their background is physical therapy. And so they built this chair that you sit in, and it forces the body to do thousands of Kegels in less
have
than
heard
30
about
minutes.
this.
Okay.
This is the one.
Yes.
Yeah.
Yes. Okay. So, you know, you'd think it would be painful, but it's not painful. It's weird at first because, you know, you're not used to sitting in a chair and having contractions happen throughout your entire pelvic floor.
But not contractions like I'm having a baby.
No,
you can just feel it.
That's here. It's more of like a muscle contraction, and the intensity starts out very low.
Good.
And we slowly increase as you get used to it, and your comfort level is, we're always maintaining your comfort level. I've had that treatment a number of times. I've never thought it was uncomfortable.
And
it
then
shouldn't
how
be.
long are you in the chair?
You're in the chair for 30 minutes.
Okay.
And you can watch a Netflix show, you can get on Facebook. I mean,
And
you
then
just kind of read a book.
what does it do for one who has had this treatment? Because I have heard there are some benefits to having this treatment.
There are many benefits,
Yeah.
and the reason why I jumped into it is because of your results with Diva. It's looking at the whole picture. So, you know, we look at the body and being in shape, and it's about muscle and, you know, working out and water intake and supplements and eating the right foods. And with pelvic floor help and with incontinence and painful sex, all those things, there's a number of different ways to treat it as well. So Diva makes the tissue healthier, brings in blood flow. It, you know, you get more lubrication, which is one of the reasons why it's also helpful during sex. Emsella builds muscle, so that also supports the bladder.
Yeah.
So it helps with incontinence. It helps with actually with also increased sexual satisfaction because increased blood flow is always good.
Yeah.
And it's just increased stimulation down there. And so the combination of healthier tissue with Diva, supportive and stronger muscles for the bladder, increased blood flow, increased lubrication, the whole picture kind of comes together to create better experience, no matter if it's a little bit of incontinence with maybe some painful sex with, or maybe I just want a better sex life. How about that?
Yeah.
And the Emsella chair is great for men and women.
Oh.
And so, yes. And so for men.
So I feel like do men really need help with that? I feel like, okay, they do.
Yeah,
okay.
they do. And so one of the things with men is urgency. Getting up, you know, they can't sit through a plane ride.
Yes.
Can't sit through a car ride.
Yes.
Can't sleep through the night.
Correct.
So urgency is what we use, typically what men are coming in for, but also increase in sexual satisfaction. Like if women are having all these treatments and they're, you know, especially with some bioidentical hormones on board, you know, and one partner's doing it and the other partner's not.
Yeah.
You know, it's just not quite as good. But if both are doing it,
do it together.
Yeah.
But I'm not going to be like walking down the street and be like, woo! It's not like that.
No, wouldn't that be great?
It's not going to just spontaneously happen, but it does help. I just want to clarify. It sounds powerful. You're like sitting with your mother-in-law having coffee and hello, there it is again. Anyway, I want to try it.
No, yeah.
Are you going to cut that? They're going to cut that out.
Oh, maybe not.
I want that treatment.
It's good for them to know, though, right?
I know. Well, I do want to clarify, and
It's
we
good
did
for
it in
you
a
to
funny
know.
way, but I actually wanted to clarify that it's not going to.
No.
You know.
So when you're sitting in the chair, you're feeling the contractions. You definitely, it's not, and two, when you get up, it's not like it's painful or sore or anything like that. But you just notice it when you are going to when you're having sex.
Good.
Yeah.
I want to go do that treatment right now.
We can turn that chair on. We should have brought the chair
that
in.
sucker up,
You could have sat in the chair while we did this.
We need to do this every week. Yeah. This makes me laugh. Makes me happy.
All right. So any other treatment aesthetic care that you've had that we haven't talked about? I'm trying to think of the list as I went through.
I will ask you something. My children had maskne. Maxne? What do you call it? I did not. Both of my college children, for the first time in their lives, got acne from the masking.
Yeah.
And we did use a treatment here for both of them, and they're still using it. And my daughter has gotten better results than my son, but my son was also a little bit of a later bloomer, and so I think his is hormonal on top of the mask issue, but a lot of people are having the acne with the mask.
Definitely, and they're also at a time in their life where their diet's probably not the best. And the diet always comes out on the skin. And so if they're eating a lot of dairy, if there's some alcohol involved and not enough water and they're sleeping. So I get that. I also have a 19-year-old, so we're on the same page with that. But all that stuff aside, products are so important. And we have a couple of different products that are really great. We actually have a new product that we're just getting in. It's a treatment that can be used from head to toe. So for some of our teenagers too, they get the back acne.
Yes.
Or they get folliculitis and irritation when they shave. It's a cleanser that's an antimicrobial, it's an anti-inflammatory, and it also has salicylic acid in it, so it helps to exfoliate off the surface. So if they're getting acne, it helps to heal the acne. But it also helps to strengthen the barrier in the skin. And most dermatology, like most issues that happen in the skin, the barrier's been disrupted.
Right.
And so this cleanser really helps to mend that barrier. It actually also kills COVID.
Oh, that's
It
good.
also kills staph.
Yeah.
So, and so that product alone, it's called CLN Clean Wash, and there's a professional version or professional strength that has the salicylic in it. So, I mean, that's a great treatment. And then there's spot treatments that are very commonly used that we have here. So, I mean, I think the best thing, especially with acne, is to come in for a consultation. Because there's, whether it's the mask that's causing it, or it's hormonal, or it's, adult women get acne. So it's great to come in, have the consultation. We can put together a program that will manage it between in-house treatments like our clarifying facial, BBL treatments that kill the bacteria and help with the redness that happens with scarring, and then at-home skincare. So lots of fun things. I got all sorts of skin solutions. Well, it was so great to have you in today.
For having me.
Really just love you so much.
Thank you
you're
for
just
having
so
me.
fun.
I'm gonna check out that chair.
Yeah, we're gonna get you on the chair. Yeah. So
thank you for having me.
Yeah, thank you. So that was it. If you have any questions for us, please reach out to Aesthetic Care, book a consultation. One of our amazing experts will take great care of you.